Hey, what's up, guys? This is your daily COVID-19 update brief or intel brief, again, whatever you want to call it. Everything is current as of today, April 2nd, 2020, and time wise, it was roughly about 2000 Eastern Standard Time. Today, I'm going to kick it off with something a little bit different. We're going to go ahead and talk about what's going on around the world or in this part of the country. Starting out with the first one, I'm going to talk to you guys about the efficacy of wearing a mask out in public during the pandemic. So I threw that article up there just because I'm taking some of the information or basically the graphics from that article, but a lot of the information is coming from research papers that were published and reported, and I'll have all those links down in the description below if you're curious. Also, if you've been following on the news, the commander of the aircraft carrier, the naval carrier Roosevelt, has been removed for poor judgment. If you guys remember, he was pleading, trying to ask for help because he had 100 sailors that had the coronavirus on the ship. 600 people came back negative. They already had like, I think another 2 to 3,000 they needed to test. But the thing is, they couldn't get everybody off the ship because of nuclear weapons. That's unfortunate if you're tracking that. Next headline was a national lockdown. Should it be imposed? President Trump is thinking about it. I think it's a good idea, especially in the major cities. Governors are trying to do everything they can. But again, we're seeing exponential growth, and I don't think that's a bad idea if we did that. And then just a feel good story, a million N95 masks were flown from China back to Massachusetts by my man Robert Kraft. I'm a big Patriots fan, so that's just a good story all around. So I'm happy to see that, and those masks will definitely be put to good use in Boston and the surrounding area. So there's some headlines, right, that we've been tracking today and yesterday. So let's go ahead and we'll jump into the numbers and what's going on currently today over the last 24 hours. So we're up to total cases 1,014,296. So that's a growth of 9% in the last 24 hours. Number wise, it's 83,000 cases. And then a total deaths of 52,982, a growth of 13%. So that actually went up 2%. It was at 11% the last 24 hours or 48 hours ago. Roughly 5,300 death increase in the last 24 hours. Right now, the U.S. case fatality rate right here is sitting at 8.7%. That went up roughly 3%, but again, that's going to continue to fluctuate. So don't be too concerned on that until we get, those actual numbers coming in. But I like to throw that up there, and this is how I determine my case fatality rate. If you are interested, right here, you can read that as I continue on. My key assumptions, nothing has changed. Right now, I'm tracking with the way that Italy has able to contain the spread of the virus with the national lockdown. Right now, it looks like on the 4th, they're going to be looking at right around 16,000 deaths. So that's good, great on Italy. If you've been following along too, their growth rate has continued to decline over the last week, and we'll go over that a little bit later. But the other key assumption that I made yesterday that I did not add, I wanted to add it to the slide, is expect the United States to pass Italy and Spain in total deaths by 8 April 2020. And that's under the assumption that all three countries continue their growth rate that they're at today. So I believe that Spain is right around 11% for the last like 7 days. Italy's right around 8%, and then the US is roughly at 26%, I believe it is. So if they continue on that path, expect the US to pass Italy and Spain in total deaths by 8 April. So we'll track that. So getting into total deaths in the last 24 hours for each country. United States is up to 6,063. United Kingdom 2,921. France 5,387, Germany 1,107, Spain 10,348, and Italy is 13,915. So there's some good news, guys. Good news is Italy is now doubling every 9 days, up from 8 and then previously 7 a few days ago. So again, they continue to uh, go in the right direction, right? They've hit their apex, it looks like, and now they're on the down slope of this curve, or their apex. Um, but it's going to be a while, right? It's not going to be something that's going to happen overnight. This is still going to be at least 2, 3, 4 weeks of mass casualties, right, before we really see it level off. Spain, they went from 5 days, they're up to about 5.5, almost 6 days from when they have doubled last. Germany's at 4.5. They've been containing the spread very well, if you've been following along. United States, United Kingdom are at 3 days. United Kingdom had a big spike yesterday, not as big as one today. However, it's still alarming. What's really alarming though is France. France was almost at 5 days doubling, and then they had a huge spike. So if you see the difference between their growth percent yesterday and the growth percent today, it was just crazy. I think it was 1,300 and something deaths overall in the last 24 hours. Very concerning, very sad to see. So we'll kind of look at some numbers and see why that could be. But yeah, everybody else, like I said, United States, United Kingdom, continue to climb and double every 3 days. So go ahead, we're going to pull this up as I like to look at it and look at the difference. I'm going to make this nice and big. Hopefully everybody can see it. Oh, I guess I can't. Oh, I guess I attached this one to the graph, so hopefully you guys can see. So just in the last 24 hours, right, the serious and critical patients is what I'm paying attention to when I look at this. So United States went from 5,000 to 5,400. Italy went from 4,053 to 4,035, or excuse me, vice versa, right? 435. And then Spain increased by a few hundred, 5,800 to 6,092. Germany increased by roughly 500 patients. And then France, again, they increased by about 400. So if you look here, France has an awful large amount of serious and critical patients, which I assess is why they had such a huge number, 1,353 deaths in the last 24 hours, compared to 509 deaths. I can't remember if it was yesterday or the day before, but I was talking to you about that New England Journal of Medicine paper that was published, and their findings, which match very closely, very similar to what China was finding back in February, was that the death rate in these guys right here, these patients that are in ICU, that are hooked up to these ventilators, that are in serious and critical condition, is anywhere from 37 to 50% death rate. So again, that's insane. So that's why I like to track this. It kind of gives us a better understanding of how fast countries are continuing to grow, right? As we see a couple of these countries, United States, France, UK, they're increasing by 4, 5, 600 critical ICU patients every day, whereas Italy and Spain, they're only going up by maybe 30, 40, 50, or 100 or 200. So much smaller patients as far as that goes. Just because confirmed cases, guys, is not going to give us an exact estimate, so we really can't go by that. We have to go by the people that are actually in the hospital. Because as we know, most mild cases, right, the guys that are at home are going to recover just fine. So we'll go ahead. We're going to delete this one. We'll track this one for tomorrow. But yeah, that's what we have going on for the countries. We're going to scroll down. I set this up a little bit different now, so that way I'm not kind of scrolling back and forth. We'll go into the states. These are the overall states, including New York. As you guys know, I don't really like to include New York just because it makes all the other states seem irrelevant. But if you're curious, New York is up to 93,000 confirmed cases and 2,538 deaths. And again, that was as of like just after 2000. I think it was like 2010, 2015. But if we go into the other states that I've been tracking, some of these are ones that I like to pay close attention to just because I have family, friends, or coworkers that are from these areas, so I'm tracking for them. And then others are just good data points, right? Because they're increasing at an alarming rate. So right now, Louisiana is the only state doubling every 72 hours in cases confirmed. And just like I was saying before, this is why I don't like to track cases confirmed, because it means absolutely nothing to me. Because when you look at the death rate, New Jersey, Connecticut, and Massachusetts are doubling every 2 to 2.5 days. Florida had an insane uh, growth overnight as far as the death rates go. So they went from 87 deaths to 144 deaths in the last 24 hours. And then Michigan, Illinois, New York, Maine, Louisiana are doubling every 3 days. Virginia and South Carolina didn't quite make any list this time. But if we go up here to New Jersey, 537 deaths, 417 from Michigan, Louisiana's 310. Then we have California at 234. And then we have a lot of guys right around 140, 100, 114, one is. I can't get them all. But yeah, so a couple of them are right around there, right? Maine had no Maine stayed at 7, no change in that. But again, alarming guys, if you look at New Jersey and you look at Michigan and then even Louisiana, right, as it continues on, it's looking a lot like what New York did, right? That exponential growth. And from what I talked about yesterday, when we're talking about exponential growth and with the IHME graphs and their predictions and their assessments over the next couple of months, right? We're not even going to hit the apex for the country until April 16th. So projected growth, this is just showing what I talked about earlier on. I did change this a little bit because I had made a minor miscalculation when I was looking at it tonight. So initially I said between 5 and 8 April, but according to uh, what I was kind of doing for the math tonight, fix that minor miscalculation, and I'm getting right about the 8th. So I'm just going to keep the 8th for now. If I'm off by a day or two, it's still close enough, right? Because every day growth rates are going to change, the percentages will change as far as confirmed cases and confirmed deaths. So there you go, guys. That's the data for the United States and some of the countries globally that we're tracking. As I told you in the beginning when I was starting up, I wanted to talk to you about the efficacy of wearing masks. If you remember when this thing started to blow up, the World Health Organization came out and they were like, don't wear masks. It's not going to help. If you're a healthy person, there's no need to wear a mask. Save the mask for sick patients who are already sick with the coronavirus. Save them for the doctors and save them for uh, who did I say? Oh, the immunocompromised. There we go. So those three people, right? And didn't really play off the whole healthy person. They didn't really go further than that. If you read the report, and I can pull that up if anyone's interested, uh, they went on to talk about doctors and how there's not going to be enough for the doctors and the healthcare workers and the first responders. So when you initially read that, it wasn't a sense of, geez, masks aren't going to protect me. Really, it sounded like we need to conserve as many masks as we can, so that way when this, mm, for lack of better words, when this crap hits the fan, right, we want to ensure that the guys that are on the front lines have enough PPE, right, to protect themselves. So it didn't make sense to me. And I've been preaching since then, right, that you should wear a mask. And I've been made fun of. I've been told that I'm crazy, this and that. So what I'm going to do is I have a couple of journals, a couple of articles that were published um, that I'm going to put down in the description below for you guys to look at that talks about the efficacy. But I'm going to talk to you a little bit about viral load and how that's important with the coronavirus right now and what China has seen, what Munich has seen. There was a report from the United States. I don't know. I think I closed out of that report. Let's see if I can find it. But basically, what it talked about was the patients who are quote unquote, because I'm not a medical doctor, so I don't know the actual term, that are full with the coronavirus. Those are the patients that are going into ICU and unfortunately passing away and succumbing to the virus. So when we talk about viral load is just the amount of the virus that an individual has within the um, uh, fluid, which is most commonly a volume of fluid, right, which is usually blood or plasma, right? So when they pull, when they when they take your blood or take your plasma, this is the virus that they're seeing in here, right? So how much viral load is in your volume of blood, right? And then when we're talking about infectious load, that's basically is the amount of the virus that an individual needs to be exposed for them to pick up that virus. And when we're talking about flu viruses, influenzas, the coronavirus, things like that, an individual only needs to pick up a very small amount of particles for them to become sick, right? So here we have a graphic that depicts an infectious load. So if we talk about a mild infection transmission, right? So this person has a mild amount of viral load, right, in their blood or their plasma or in their cells altogether. So the infectious load won't have as much for the individual that they're infecting. Whereas a severe infection transmission, right, somebody who has a higher viral load or is full of the virus, right? The exposed person will have a higher infectious dose because what happens is when the virus, if you come down here, when the virus attacks your cells, right, it basically will take over your cell. It will replicate, right? One becomes two, two becomes four, four becomes eight, whatever. I don't know. It replicates very quickly. And what happens is your body can't attack the virus quick enough, right, to defeat it and for it to only become a mild infection at that point for you to survive or for you to get better. So unfortunately, what they're seeing is the patients, like I said, that are in these ICUs have a very high viral load in their blood samples, right? And then you see the COVID-19 viral shedding timeline. By the time you're exposed to showing symptoms, peak shedding, which is basically when you're infectious and you're infecting everybody else, you're unlikely to infect others on day 14. That's crazy, guys. It takes 2 weeks. You're a walking infectious person for 12 to 14 days, which is nuts. But if we come down to this graph too, right, I wanted to show you the viral growth based on initial infection load to kind of give you a better example. So this is assuming HIV doubling time of 0.65 days, right? So you have your viral load here and you have your days. So the initial load, if somebody had 5 RNA copies, right, the initial load, much smaller as far as their viral load is over the amount of days if they were to be sick and get their blood drawn here compared to this. And what that difference is, guys, between an initial load of 5 and 25 is you touching your face, right? And putting your fingers to your nose, to your eyes, to your mouth, and getting that virus inside of your body and ingesting it. And what actually can help with that is a mask, a homemade mask, a surgical mask. I'm not telling you to go out and buy respirator masks, right? Because that's what the frontline first responders need to have. But these guys at Cambridge University, right, wanted to see the efficacy of homemade masks with household materials, right, and the effectiveness against zero point zero 0.02 micron particles, which is roughly the size of influenza viruses, if I'm not mistaken. I'm trying to remember exactly what the article talked about. But if you see the results here, surgical mask was anywhere from 89 to 97% effective. Then you have a vacuum cleaner bag, a dish towel, cotton blend t-shirt, pillowcase, etc. And basically what their study found, and I'll link that down into the in the description if you're curious, is that even just by wearing a mask made out of your cotton t-shirt, your pillowcase, is going to reduce or has the potential of reducing the amount of the initial load, which is this right here. So again, the smaller the initial load that you uh, initially get into your body could be the difference between having a mild case of coronavirus or influenza or anything, right, that we're talking about, and a severe case. And if we're talking about coronavirus, then all the reports show recently that a majority of the patients who are considered severe, who are considered critical in the ICU, have all had a large amount of viral load, 1,000 times higher than SARS, is one report that reported that. And I just want to say that if we were to wear a mask, it could be the difference of 100,000 deaths here in the United States, 200,000 deaths, 50,000, 10,000. It doesn't matter, right? It has the chance to stop the spread, stop the infectious rate, and potentially stop a large amount of deaths. And I do not know why it wasn't pushed out sooner, and it's unfortunate. Uh, but yeah, I just wanted to show you guys that. As you know, I like to kind of go over the numbers first, then kind of go over some different facts or some different things that I'm seeing that's not quite being reported on all the time. If you like this video, if you think the data is helpful, please leave me a comment. If I said something mistakenly incorrect, please correct me so that way I can fix it. I don't want to give infactual and accurate information, I should say. But yeah, I'll be here tomorrow, guys, with your next daily update.